Your eyes might be showing signs that something is wrong with your blood, something serious, and most people don't even notice. Your eyes could be telling you something important before you feel sick anywhere else. Here's something most people don't know. When blood cancer starts developing, your eyes often show it first, before you feel tired, before you notice anything else. Research shows this happens. Your eyes are connected to your blood. When your blood changes, your eyes can show it. You look in the mirror every day. You see your eyes. But do you really look at them? Do you notice when something is different? Most people don't. They miss the small things. A spot they've never seen. The whites of their eyes looking pale. A blood vessel that looks bigger than before. These little things matter, and if you know what they might mean, you can get checked before something becomes serious. Hello, I'm Dr. Claire Carter. I've spent 10 years learning about blood cancers and how they show up in your eyes. And what I've learned is this. Blood cancers, like leukemia and lymphoma, they often leave signs in your eyes. Not always, not in every person. But when they do, you can catch them early. And early means treatment works better. Over the next few minutes, I'm going to tell you what researchers have actually found about blood cancer and your eyes. I'm going to explain what eye changes can mean. I'm going to tell you when to worry and when not to worry. And I'm going to give you real information so you know what to do if you notice something unusual. By the end of this video, you're going to understand what your eyes can tell you about your blood. You're going to know which eye changes need checking and which ones are probably nothing serious. You're going to have clear steps to take if you notice something unusual. That's information that actually helps. What happens when blood goes wrong? Let me start simple. Your eyes need blood. All the parts of your eye, the back where you see, the nerves that carry information to your brain, all of this is fed by blood vessels. When your blood is normal, your eyes work normally. But when something goes wrong with your blood, when you have a blood cancer, sometimes your eyes show it. Now, I want to be honest, this doesn't happen to everyone with blood cancer. And when your eyes do change, it doesn't automatically mean you have cancer. Many other things cause eye changes. But research has shown us that sometimes eye changes are the first sign that someone has a blood cancer. Research shows that in about 1 out of every 10 to 20 people newly diagnosed with acute leukemia, eye changes were visible during their eye exam. That's not a huge number, but it's important. It means your eyes can sometimes catch something before anything else does. The key thing: eye changes prompt your doctor to do blood work. And blood work is what actually finds cancer. Here's something important. Blood cancers found early are often treatable. Research shows us that survival rates are much better when blood cancer is caught early. So if an eye change makes you get checked and something is found, that's actually good. Early finding changes everything. Dark spots in your vision. One thing research shows is that some people with blood cancer see dark spots floating in their vision. These are called floaters. Here's what's happening. Blood vessels in the back of your eye are bleeding. Tiny bleeds. You see them as dark spots or lines floating across what you see. Now here's the honest part. Dark spots in your vision usually come from other things. Getting older causes them. Diabetes causes them. High blood pressure causes them. These are way more common than cancer. Research shows that when doctors check people with dark spots in their eyes, most of them have diabetes or high blood pressure causing it. Only a small number have blood problems or cancer. But that doesn't mean ignore it. If you see new dark spots that weren't there before, see your eye doctor. Your eye doctor will check you. If they see bleeding in your eye, they'll make sure your blood pressure is okay. Check if you have diabetes. They might order blood work. That blood work would show if there's a blood cancer. The point: dark spots deserve checking. Most times, it's not serious, but checking is the right thing to do. Have you noticed dark spots in your vision? Floaters? If you have, that's worth mentioning to your doctor. Not because it's probably serious, just because it's different from before. Your eyes look pale. Another thing research shows us is that when people have blood cancer, sometimes the whites of their eyes look pale. Here's why. When your blood doesn't have enough red blood cells, when you have anemia, the tissues in your body don't have their normal pink color. Your eyes look pale instead of healthy pink. Now, anemia happens for many reasons. Not enough iron, not enough B vitamins, kidney problems, and yes, sometimes blood cancer causes it. Research shows that about 7 out of 10 people newly diagnosed with acute leukemia have anemia. That's very common with leukemia. But here's the thing, anemia is also common from many other causes. So pale eyes alone don't tell you much, but pale eyes combined with feeling very tired, that's worth checking. If someone tells you that you look pale, if you notice in the mirror that your eyes look whiter than they should, if you're feeling more tired than makes sense, that's when you see your doctor. Your doctor does a simple blood test. In 5 minutes, the test tells you if you have anemia and what might be causing it. Do you feel more tired than you should? Like you sleep 8 hours and still feel exhausted? Combined with looking pale, that's worth a doctor visit. The nerve behind your eye. Behind your eye is a nerve called the optic nerve. It carries information from your eye to your brain. This nerve has blood vessels feeding it. When blood is very abnormal, when there are too many bad white blood cells, the blood doesn't flow right to this nerve. The nerve can swell. It can look pale from not getting enough blood. Your eye doctor would see this during a check. You wouldn't feel anything. You might not know anything is wrong, but the doctor would see it. Research shows this happens in some blood cancer patients, but it's not common. It's one of the rare ways blood cancer shows up in your eyes. If an eye doctor sees this, they order blood work. The blood work shows what's happening. The good news: when doctors investigate unusual eye findings, they find treatable things. Sometimes it's nothing serious. Sometimes it's something that needs treatment. But in either case, finding out helps. That's why checking is important. The retina changes. What research shows? The back of your eye has tissue called the retina. This is what lets you see. Research shows that in some blood cancer patients, the retina looks different during an eye exam. It might look whiter than normal in places. This happens because the blood isn't flowing right, and those areas aren't getting enough oxygen. This is another rare sign. Most people with blood cancer don't have this, but research has documented that it can happen. The key thing: your eye doctor knows to look for this. If they see it, they investigate. They do blood work. The blood work shows what's happening. This is why regular eye exams matter, not just to check if you need new glasses, but to catch unusual things early. The symptoms that go together. Here's what's really important. Eye changes alone don't mean blood cancer, but eye changes plus other symptoms, that's when your doctor gets concerned. Research shows us that people with blood cancer usually have some of these symptoms. They feel exhausted, not just tired, exhausted. Even with good sleep, they feel worn out. Research shows about 8 out of 10 people with newly diagnosed leukemia feel this way. They have fevers that come and go. Not high fevers like with the flu, just low fevers that keep happening. Research shows about 7 out of 10 leukemia patients have this. They bruise easily. Small bumps cause big bruises, or they have nosebleeds, or their gums bleed when they brush teeth. Research shows about half of people with leukemia have bleeding problems like this. Their lymph nodes are swollen. These are little bean-shaped things in your neck, under your arms, in your groin. You can feel lumps. Research shows about half of lymphoma patients have this. They lose weight without trying. They're not dieting, but weight comes off anyway. Now, if you have an eye change and none of these symptoms, the chances of blood cancer are very, very low. But if you have an eye change, and you're exhausted, and you're bruising easily, and your nodes feel swollen, that's a pattern. That's when your doctor is really concerned. That's when blood work becomes urgent. Do you have more than one of these symptoms? Feeling exhausted plus bruising easily plus fevers? If you do, along with any eye changes, that's important. That's worth getting checked now, not later. What doctors actually do. When you notice eye changes, here's what happens. You see an eye doctor. They look at your eye with special equipment. They can see the back of your eye really well. They take pictures sometimes. If they see something that needs attention, they tell you. Then you see your regular doctor. You tell them what the eye doctor found. You mention any other symptoms. Your doctor does blood work, a simple test that takes 5 minutes. It shows your red blood cells, white blood cells, and tiny clotting cells. If something is wrong with your blood, this test shows it. That's it. That's how you find out if something serious is happening. Research shows that early checking, not waiting, but getting checked when you notice something, changes how things turn out. Finding something early means treatment works better. The good news: this is all simple to do. Eye exams are easy, blood work is quick. Your doctor knows what to do with the results, and if something is found early, you have better options. I want to know, have you noticed anything unusual with your eyes recently? Have you felt exhausted for no reason? Have you noticed bruising? Have you had your eyes checked lately? Drop a comment. Because sometimes, when someone shares their story, it makes other people finally make that appointment. Your comment might matter to someone. Let me be very clear. This video is educational. It tells you what research has found. It does not diagnose anything. If you have eye changes, it doesn't mean you have blood cancer. Most eye changes come from other things. But if you notice eye changes, see an eye doctor. If you notice eye changes and you're exhausted and you're bruising and you have fevers, don't wait. See your doctor right away. Only blood work diagnoses blood cancer. Only your doctor can look at your situation and give you real answers. This video gives you information. Your doctor gives you diagnosis. You know what I've learned in medicine? The people who catch problems early are the ones who notice. They see something different. They mention it. They don't ignore it. They don't worry. They just notice and act. I'm not telling you to be anxious about every little thing. I'm saying, pay attention. Your eyes are talking to you about what's happening inside your body. If something looks different, if something feels wrong, mention it to your doctor. That's not anxiety. That's good sense. Thank you for learning about this. Pay attention to your eyes. They're smarter than you think.